Hi, and thanks for joining us. My name is Ryan Carnahan. I'm a psychiatric pharmacist and researcher working at the University of Iowa. This brief video is an introduction to the training and toolkit we're offering as part of the project Improving Antipsychotic Appropriateness in Dementia Patients. The goal of this project is to help you and others provide the best possible care to people with dementia and problem behaviors or psychosis. The Agency for Healthcare Research and Quality has provided our team with funding to bring you this education. We're also offering clinical tools, algorithms, and other online resources to work towards this goal of the best possible care for people with dementia. In this brief video, I'll be introducing you to our training program and products. I'll begin by discussing some background information on antipsychotic side effects and the reasons we believe there's still room for improvement in the way these drugs are used in dementia. I'll then overview the tools and training program our team has developed to improve care for people with dementia and problem behaviors or psychosis. Finally, I'll be introducing you to a patient that is featured in our series of brief online videos. We've done our best to keep these videos short while still touching on the most important concepts. Our clinical tools and online resources, available through the Iowa Geriatric Education Center's website, provide more detailed information. Why do behaviors and psychotic symptoms pose such a challenge in people with dementia? These problems can be very distressing to the patient, caregivers, family members, and others. They can also be very difficult to manage, and there are no medications which are both safe and effective for this purpose. Antipsychotics are often prescribed for people with dementia who are experiencing psychosis or exhibiting problem behaviors. Unfortunately, their effectiveness is modest, and they have serious side effects, one of which is an increased risk of death. Non-drug management strategies can be very helpful for managing problem behaviors in people with dementia. However, many providers don't feel well trained in managing behaviors. Often they resort to using medications, and sometimes this isn't the best choice. In May of 2011, the Office of the Inspector General for the U.S. Department of Health and Human Services released a report on antipsychotic use in nursing home residents. After reviewing medical records for a sample of patients treated in the first half of 2007, it was concluded that about 22% of antipsychotic prescriptions in nursing homes were not given in accordance with the Centers for Medicare and Medicaid Services standards regarding unnecessary drug use. As you can see from the table, many of these drugs were given at too high of doses, for too long, without an acceptable reason, without enough monitoring, or in the presence of adverse effects that indicated the dose should be reduced or the drug discontinued entirely. Our hope is that our training and products will help improve these numbers, reflecting improvements in care. As I mentioned before, antipsychotic use has been associated with an increased risk of death in people with dementia. This led the Food and Drug Administration to issue a black box warning in 2004 to communicate this risk. The finding of increased mortality with antipsychotic treatment has been consistent across many types of studies. In studies of people with dementia that compared these drugs to placebos, the risk of death was about 3.5% in people who received antipsychotics and 2.3% in people who received placebos. These studies found that anywhere from 5 to 14 people need to be treated with an antipsychotic in order for one to show meaningful improvement in behaviors or psychotic symptoms. For every 83 people treated, there was one additional death associated with the antipsychotic. That means that for every 9 to 25 people helped, there appears to be one excess death associated with antipsychotic use. Antipsychotics can cause many adverse effects other than death, underscoring the importance of only using these drugs when necessary. Side effects include sedation, falls, movement disorders, also known as extrapyramidal side effects, weight gain, and diabetes. Their use has also been associated with strokes or cerebrovascular events. The risk of stroke was about twice as high in people getting antipsychotics compared to placebos, with about one excess stroke for every 100 people treated. Most of the deaths in studies that found excessive mortality were related to infections or heart problems. Antipsychotics are known to affect cardiac conduction in some people and have been linked with sudden cardiac death in some studies. Caution is clearly needed when using these medications in people with dementia. This slide is meant to illustrate that many factors interact and contribute to problem behaviors in psychosis and dementia. The approach we're advocating for in our training program and products acknowledges this complexity. These problems are common, especially in the later stages of dementia. However, the causes can vary dramatically from patient to patient. Our clinical tools include resources to help providers sort through and address the underlying causes of a patient's behaviors or psychosis, instead of just reacting to these symptoms. Throughout this education, we will promote a stepwise approach to management such that behaviors or psychosis can be addressed in a systematic and logical way. It is important to first establish that everyone is safe. Once that's ensured, teams can work towards clearly characterizing the frequency and severity of specific behaviors or symptoms, and trying to determine the cause of the behavior. Exploring past treatments and outcomes can help determine which treatments might be useful for the current situation. It's worth mentioning again that non-drug management strategies should always be considered before resorting to a medication. Finally, it's important to discuss the risks and benefits of different treatments with patient families, or patients themselves, if they have capacity. Our clinical tools provide guidance on the details of this approach and also include a handout for patient families to help them understand the risks and potential benefits of antipsychotic medications. Now on to the specifics of our training. This video is an introduction to our case-based mini-lecture series. Each lecture focuses on a specific aspect of managing problem behaviors or psychosis, from assessment to treatment to monitoring. We also have laminated pocket guides and algorithms which we hope will serve as convenient references. These are described in more detail in the mini-lectures, and copies can be requested through our website. This website also includes more detailed information and references that explain the rationale and evidence for the pocket guides, algorithms, and lectures. Finally, the Iowa Geriatric Education Center is offering a course which provides detailed training on non-drug strategies for managing problem behaviors in psychosis and dementia. This course focuses on understanding the underlying meaning of behaviors and provides recommendations for specific approaches to various problems. It also fulfills a training requirement for providers working in dementia units in the state of Iowa and may fulfill similar requirements in other states. As mentioned already, the pocket guides and algorithms in our toolkit address various aspects of patient management. The first pocket guide overviews the stepwise approach to treatment and includes a list of common causes of problem behaviors or psychosis. It also recommends specific assessments to consider to rule out various possible causes. The second tool is a delirium screening and management pocket guide. This is included since delirium is a common but reversible cause of problem behaviors and psychotic symptoms, which is often overlooked. The next pocket guide lists drugs that can contribute to delirium, problem behaviors, or psychosis. People with dementia often receive drugs that can worsen their condition or pose risks of side effects. Our hope is that this product will help providers sort through medications that may contribute to behavioral problems or psychosis. The next product in our toolkit is a brief document to help care providers think about how to address a behavioral crisis. That includes ensuring safety and making sure their own actions and reactions are working to improve the situation and not escalate it. Next, we have two products that focus on non-drug management techniques for dementia. One is a detailed algorithm in a poster format, and the other is a pocket guide. Finally, we have two pocket guides to help with prescribing and monitoring of antipsychotic medications. One is meant for prescribers and other clinicians who might be selecting, dosing, and overseeing monitoring of antipsychotic treatment. The second is for care providers and focuses on appropriate versus inappropriate uses of antipsychotics, as well as monitoring for side effects. Finally, I mentioned earlier that we've developed a handout to help guide discussions about the risks and benefits of antipsychotics. This can be given to families to help them understand and participate in treatment decisions. It may also be discussed with patients if they have the capacity to understand. The handout will be most useful when a healthcare provider discusses the information with the family or patient. This will help put the information into the context of a given patient's situation and ensure that the information is understood. Now I'd like to introduce you to Mrs. Annabelle Klein, the featured patient in our mini-lecture series. Mrs. Klein is a 71-year-old woman with moderate dementia who was recently admitted to the Pine River Nursing Facility because home care demands became overwhelming for her husband. Like lots of older people with dementia, Mrs. Klein's care requires thoughtful attention to the complex interaction between her past history, the environment, medical problems, drugs, and other factors that can affect her condition and behaviors. We hope that her story can illustrate some key learning points and help you understand how to apply the clinical tools and a systematic approach to providing the best possible care for a person with dementia and problem behaviors or psychosis. We hope that the training program and resources we're offering will help you in achieving this goal of optimal care. Thanks for listening.